She has a fatty tumour under the skin outside the abdomen. I think she also has a swollen liver, which is probably infiltrated with fat and fatty disease. She has 2 lots of bruising at least around the tumour, and we have established that she has had a couple of falls, that she climbs up onto things, and because she can't fly and she's got a damaged wing, she sometimes falls, and I think that probably explains why the bleeding has occurred. I can't see any bruising in other areas of the skin. I do predict that the white part of her droppings will start getting a green tinge to it over the next week as the blood gets reabsorbed into the body from the bruise. So some of the biliverdin is the name of the chemical that will come through in the white part and give it a green tinge. That at other times without bruising would indicate liver disease. But at this time it is likely to indicate that it's just the blood being reabsorbed from the body. Now, I've also indicated that because of blood loss and because I think it's likely to be unnecessary, I'm choosing to guide you away from surgery at this point in time. I'd like to get some measurements of those tumours. We've got a photographic record, and I want to see them shrinking gradually over the next 3 to 6 months. There should be a noticeable improvement within 3 months. So I want to monitor. If they're getting bigger in the first month or second month, then I will reappraise the need for surgery. But what we're doing at the moment is that I'm going to give you, for her, a product that contains a patented agaricus mushroom extract. So I've written on here that I wanted to have 2 to 3 drops of the diluted solution twice a day by mouth if you can, for 30 to 60 days. If you can't give it by mouth, then we'll need to go through the bottle more quickly by putting it in her food. But more economical to give it directly by mouth. I'm also giving you some diluted zeolite solution, and that'll also be about the same dose, 2 to 3 drops twice a day for 30 to 60 days of the diluted zeolite. And those 2 things, the agari in people is patent for stimulating the immune system, and I want her immune system turned on to start recognising this cancer as what it is, and it's a benign cancer. I don't think it's a malignant cancer. However, they very often get multiple ones. Sometimes some Galahs come in here with 4, 5, 6 of them, but they're not the sort that tends to invade into the brain and the liver and the lungs and all those sorts of things. Not like that. So we need to help the immune system. We need to try and get rid of as many toxins out of her body as possible. Heavy metals hopefully will be addressed by the zeolite solution. We've made up a mixture of 4 different products in powder form that contains a source of powerful antioxidants. It contains all 8 essential sugars. It contains the precursor molecules for the hormones via wild yam extract. It contains up to 12 or the extracts of up to 12 vegetables in concentrated form. So even if she won't eat her greens, we're getting a lot of nutrition into her. And I've provided you with some patented goji juice as well. So with the powder here, what we'll be doing is, well, first of all, with the goji juice, we'll be moistening some of her food. We'll be putting her on a restricted diet for weight reduction, and you can find that in my book, Caring for Birds with Love. There is a weight reduction diet for Galahs. And I'll give the principles that we work out pretty precisely how much she's eating each day